Coming to you from Trans Thrive in San Francisco, it's a Shot in the Arm podcast with me, Ben Plumley. Well, regular listeners and viewers will know that I'm also the board president of the San Francisco Community Health Center, which houses Trans Thrive. And it's an extraordinary, amazing jewel in San Francisco's Tenderloin, uplifting communities that would otherwise not have access to the kind of social, health, employment and education opportunities that other parts of the community would have. It's a safety net for those who fall through the safety net. And it's that time of year where we're coming up to the annual Show of Hope, the San Francisco Community Health Center's fundraiser. And in the show notes, you can find out more about the event itself and how you can support it. So, we're here in Trans Thrive. It's designed for and run by our trans community. And, well, trans issues have definitely been the latest lightning rod in our culture wars, whether it's violence against trans women of color, whether it's who advertises beer on our television screens, who can participate in sports, and actually who can have access to the kind of medical services that empower and enable lives, indeed save lives. Well, in this episode, we're going to step away from all of that hysteria, and we're going to look at what it really means and ask those who are directly affected what it's like to be trans in 21st century America, and why spaces like Trans Thrive are so important, so crucial. And our guests today are two of the staff who have been instrumental in setting up Trans Thrive. First up, Monique Campbell. She is the program manager of Trans Services. Monique, welcome to the show.
Thank you for having me.
So, you've been with the centre since July 2022. Mm-hmm. What's the most exciting thing about Trans Thrive for you?
The most exciting thing for me would have to be that this is an exclusive space for trans people and ran by trans people. I know that in other spaces, it's just a segment of the space that is dedicated to trans people. And so this is just a very unique environment. It's a unique program. And it's truly special. You feel the magic when you walk into the space.
Oh, that's certainly true. And we can come back to that later on, my tears when I first came in here. We're also joined by Carsen, who is a program coordinator at the centre. Now, Carsen, you've worked for the Community Health Centre since 2016, right? But you were volunteering beforehand. What's kept you here?
I think it's funny because like from the moment I walked through the doors, I was welcomed here. Like they would will you come back again? And I was like, well, you're letting me come back, so of course I'll keep coming back. And it eventually became a job, and then hooray, I'm here. Yeah. So that's one of the things. I think it's a very much a plus in our agency that we're so welcome. We're very much welcoming, and we're very much always like willing to look at whoever comes through the doors as someone who could be around for more than just services.
And I think that's one of the really fun and important things about the centre, that it really does seek to look to employ and then build up people from the communities we serve. It's what's been so inspiring to me. But let's talk about Trans Thrive. And Monique, if I could start with you, what are the services that you offer here?
Thank you. So we actually offer the same services as our parent, San Francisco Community Health Center. So we're just an extension, but directly in the center, we offer behavioral health. We do have therapists on staff that do see our clients, but in addition, case management and psychosocial support groups, which some of those groups Carsen facilitates. We also have 2 of our clothing closets that are geared towards both sides of the spectrum. So we have She Boutique, which I am actually outfitted by today. And then we have Folk and Swagger, which is a trans masculine clothing closet.
And are you dressed by Folk and Swagger today, Carsen?
I mean, this is certainly for Folk and Swagger. Yes. Oh, I think the shoes are too. Yes.
Which, of course, we can't see. And, of course, listeners will only just have to imagine how fabulous they are. But Carsen, tell me, in terms of services for trans men at Trans Thrive, what do they involve?
Okay, so every Tuesday from 6 to 7:30, we have our trans masculine support group, which is currently taking place as a hybrid model. So folks can either attend online, since a lot of the folks who are attending have autoimmune conditions, so they still aren't comfortable coming to things in person, or they have the option to come in person. And a lot of it's just about finding a space where you could socialize and also ask questions that you would like to ask of other trans masculine folks. A lot of times folks will be supporting folks on finding out the answers to that they wanted to have from their medical providers, but they haven't been quite able to get just yet. And sometimes it's funny because it'd be things where we always wanted to play with Legos when we were younger, and I'm I can get y'all Legos. So yeah. So that's part of it. Another one we do is TM4M, which is second and fourth Thursdays, and that is a space. It's a program to build space for trans men and gay men communities.
Nice. I mean, because you often feel that those, well, actually, services for both trans women and trans men are, they can be hard to find, and they can be, ensconced in programs that perhaps are designed for gay men. And so what is it about, why is it so important to have a dedicated space, Monique?
It's very important to have a dedicated space because, as you mentioned, trans people, whenever they're in other spaces that are populated by mostly cisgendered individuals, they're oftentimes relegated to roles or positions that don't put them in a space that other trans people know that they're there or that those services are available. It's important to have a dedicated space because we're a home for a lot of trans people, where they're displaced or disenfranchised at other spaces that you're trying to receive services from. And so it's comforting for them to come to a place that they know is exclusive for them and that they have a team that's dedicated to their advancement, whatever that might be. And like Carsen mentioned, we definitely try to hire from within the community. We want to show them that this is a place that they can grow from and that they can advance. We are the possibility.
And the Trans Thrive center here was funded in part by Gilead Sciences. So there's an HIV component to this, and I'd be really interested in learning a bit more about what it means for both trans men and trans women. And so Carsen, perhaps starting with you, what are the services here around PrEP and around treatment for trans men?
Okay, so we have drop-in HIV testing throughout the week within San Francisco Community Health Center. So that's one of our major entry points for a lot of folks to come and start services for Trans Thrive. And then also, at least for part of the TM4M, there's a component where we encourage folks to how to navigate cruising safely and how to talk with their doctors about PrEP and a lot of times we'll be at helping folks find out what's available for them in terms of sexual health. So
is a lot of this education for providers as well, because I've read reports of trans men. I think this has happened more on the East Coast of the United States than on the West Coast, but that healthcare providers are saying, well, why do you want PrEP? Why do you want PrEP?
Yeah, because I think there's that frustrating part where a lot of times for especially providers don't realize that it's possible to be gay and trans, and That's one of the things that makes it a little bit tough about navigating healthcare as a gay trans man is sometimes you'll like find someone who's great about PrEP and like all the STI prevention, but the moment you go like about ask questions about reproductive health, it's like, and then you go find someone who's great about reproductive health, and then they'll be like, wait, what? Why are you on this medication? And I'm like, well, that's for PrEP. And they're like, I thought it was just an HIV. I'm like, it's for PrEP. Yeah. So
Yeah.
it's an interesting thing navigating the system that way.
Yeah. And I guess, Monique, for trans women, there are, again, a range of very specific health challenges that folk have to navigate.
Absolutely. Trans women, oftentimes, speaking from my perspective, I would have to go into an exam room and oftentimes educate my provider on how to treat me. And so what's unique about our program as it pertains to treatment or HIV prevention, we have a partnership with CalPEP, which is an organization across the bridge. And that program is nicknamed What's T? And T is an acronym for Transgender Empowerment Altogether. Through that program, we're targeting Black and brown trans women between the ages of 13 and 34, and we're bringing them from sex work back into the medical care where they can receive inclusive treatment and comprehensive treatment as well from providers that are dedicated on providing care to trans people.
And CalPEP, California Prostitutes Education Project, is also a friend of a Shot in the Arm podcast. And one of our very first episodes, I think, was with its founder, Miss Gloria Lockett. So it's fantastic to see that collaboration happen. But we touched on this briefly at the start. While there have been services for trans people, particularly here in San Francisco and the Bay Area in California, what kind of services were they? What were they missing? And why was it so important that you come together and create this space?
I'm a new resident to the Bay Area after about 18 years. And so I'm still learning about the historical happenstances for trans people. I think Carsen might be best suited to share what it was like for trans people historically.
Okay, yeah. So like Trans Thrive is actually it started as part of San Francisco Community Health Center in 2007, and like SFCHC did its best to make sure that there was a space that folks could go to. But again, we would still be sharing space with the clinic. And, it was like sometimes like it would be a cause of frustration where like either someone from the clinic would just be walking by and then they'd see us serving food and they're like, why can't I have food? And we're just like, because you're not part of the Trans Thrive drop-in. And they're like, I can be. It's like, are you trans? And they're like, no. So you're like, yeah, so it's nice having our own space now because a lot of it is like, this is a lot bigger than we've ever had before. So that means a lot more people can come, and it's not as like it doesn't get crowded anymore because it did feel a little cramped when we were just in the room that we had prior. Yeah,
I mean, it's quite a unique thing that, and it's sort of quite odd. You sort of imagine with HIV prevention services, not just in the United States but around the world, that services for trans people would be prioritized, but they haven't been. And so, I think this is one of the very first centers that is specifically designed for and by trans people. I interrupted you, Monique. What were you going to say?
I wanted to touch on your question that I think the landscape of HIV treatment and prevention in San Francisco prior to Trans Thrive's inception was scarce. Of course, like it was throughout the nation, people didn't know how to treat HIV, really wasn't concerned about preventing it. And trans people were oftentimes not even viewed or seen. And so even in the Tenderloin here, and so, San Francisco Community Health Center, formerly API, they definitely did some great and courageous work by focusing on HIV prevention and care, and then became a FQHC, a federally qualified health center, and now we're flourishing on prevention and care. And then Trans Thrive came about. It was formerly a program that the city actually housed and ran. And they were on the brink of, I think, handing it over or stopping that program. And so we took a hold of it, and I think we're about 15 years in now, if I'm not mistaken. And this is where we are now. And we're changing the landscape. We're changing the trajectory of what it looks like to treat trans people.
So give our listeners and viewers a sense of what Trans Thrive has got. As you walk in, what are the rooms, what are the services that folk could find?
Absolutely. So as you walk into Trans Thrive, you walk into 6,000 square feet of dedicated space for trans magic to happen. We have 2 counseling rooms. One is the Rose Room, and the other one is the Legends Room. So they're geared towards whatever side of the gender spectrum you feel like you're more comfortable with. We have a conference room. We're sitting in our Trans Thrive drop-in space, which also is connected by an outdoor patio space. And then we have a dedicated youth drop-in space for What's Tea. So we have a lot of different rooms, a lot of space, 6,000 square feet to do a lot of things. And we intend to implement some co-working for trans people, a co-working space, for trans people who don't find themselves comfortable in other spaces.
Nice. So could we change tack a bit? And another reason for why Trans Thrive is so important is because of the experiences that trans people to date have had in living their full lives. Would it be okay if we ask you to sort of share some of your stories and both the challenges and the opportunities? Maybe we could start with you, Monique, if that's okay.
Sure. So I grew up the youngest of my mother's children, the youngest of 3. And so I had the opportunity of seeing a lot of people make mistakes and attempt to correct them. And it gave me a different opportunity to change how I wanted my life to be. And so it wasn't a surprise when I came out to my mother and let her know that I was not the child that she envisioned me to be. It wasn't the easiest, but it was a journey for sure. I think the biggest challenge for me was navigating life with this new identity, and not knowing how to navigate through the dissonance of it all. I've had challenges with obtaining employment in some parts of my transition. It wasn't always the easiest. Like I mentioned earlier, was that I've been relegated to roles that were not of my training. And so needing to do what I needed to do to survive. And I know I share stories of other trans women having to engage in sex work for survival as well. And going through alternative methods, just trying to live. But all in all, I've been able to get my education and continue to excel. I'm blessed to now be in a position to where I manage this program and I work amongst my community members, but also my family members. And so when I think about my story compared to others, I've been blessed. I have been blessed. And I'm thankful for my journey because it brought me here. So yeah.
Thank you.
Thank you.
And Carsen, you're here. What was your journey? How did you get here?
Okay. How I ended up specifically at Trans Thrive was a librarian, actually. So when I was younger, I was like one of those kids who had like helicopter parents, but also they were so they were always up in my business. So the only place where I had any freedom was the library. Which, yes, I think that's a little bit amusing, but, so the librarian was, like, I'd always ask her all these questions, like, about, like, queer stuff and, like, trans stuff, and, like, so eventually the librarian's like, I'm not equipped for this. Here's a list of centers you could try. And, so that's part of how I ended up here. Yeah, I'm the oldest of three. I went to private Catholic school like up till college, and it was kind of funny because like the every time I had like questions about this, you had like all the nuns going like, we can't answer this for you, but, and then they would bounce me to somewhere else. So it was like so I always found that a little bit amusing, which is funny now because all those nuns will call me and it's like, I have a question on how to deal with trans youth, and I'm like, I'll have an answer. Yeah. So,
well, kudos to the nuns that they're calling you to ask rather than saying just pray it away.
Huh?
I think there's also a little bit of a funny bit there where like the same nuns were also like, you can't be a nun because you're on this journey. And I'm like, what, is it the gay thing? They're like, have you figured something else? And I'm like, what do you mean? They're like, you can't come back to us in a few years when you figure out what journey you're on. Then I come back a few years, they're like, oh, you figured it out. And I was like, how do the nuns know I'm queer and trans before I knew? Yeah.
Wonderful.
Yeah.
So as you now have this space, what is it that you hope, the next generation of trans women and trans men will have access to, and what will you uplift them? What are your hopes for them?
I hope that the next generation of trans men, women, and non-binary individuals can see that there is an opportunity for them to make their dreams come true, whatever that might be. I hope that this staff and the community members that engages in our services gives everyone an example of what can be. In addition, I hope that this can be a model for other agencies across the nation to be able to create something much like this. We need this space. Black and brown women are dying at a higher rate. And that's just plain ignorance. We can see that there's a causation to that, right? And so this is a model for a sanctuary, a safe haven. And it's necessary, it's needed.
And Carsen, one of the things I'm most impressed about with you and your work is that you bring a very positive visibility to trans men, trans queer issues. What's your hope for the future?
I mean, my hope for the future is just that, people get that chance to live the journey that they're on, right? Like, especially with like so much of the media being focused on trans youth, like a lot of times what I keep hearing are like people in their late teens and early 20s thinking it's already too late for them to start considering transition. When the wonderful thing about our agency is we see people who are starting their medical transition well into their senior years. And I don't recognize some of the ladies who come through the door. Like if you showed me a picture of who they were when they first came in versus like 5 years of like accessing services here, I'm like, I can't tell these people apart. I can't tell who these were the same person. So like, it's just a lot of times it's just, my hope is that people understand that even if you have to wait because of like safety reasons, it's never actually going to be too late. Right. Like that's just when I'm like, my hope is just like, hang on. Because even if it takes like 10, 20 years down the line, like, it's never too late to start. Yeah.
Do clients come to Trans Thrive from all across the country, or is it very much just a local?
All over.
Oh yeah, it's all over. Well, like with my group being digital, there's actually quite a few folks who are coming in from the Midwest and Florida, and occasionally even like as far as like Brazil or the UK. So, folks definitely know we exist from all over. Yeah.
In addition, if I may add, we've had parents actually contacting us from other states seeking for us to help them navigate their child's care in gender-affirming surgeries. And so in addition to that, we've had people travel and drive overnight from from other states to San Francisco to seek our services within our program. And we're also helping people who are currently incarcerated seek services, gender-affirming services. So yes, we definitely are. We're definitely entertained and known by people all over the nation.
Well, and particularly in some states, especially in the South and some of the northern, actually, some of the Midwest states, as you said. I mean, it's got a lot tougher recently. So have you seen demands and interest increase over the last year or so?
There has been a demand for us to provide a passport of how we can do gender affirming surgeries or how someone can access them through their provider in other places, other cities and states. There is definitely a demand on how we do it, since we're seen as a sanctuary state, and a lot of people are looking just for refuge, trying to figure out how can I do it, or how were you able to do it, and safely at that. So we're getting a lot of inquiry about how, right?
Yeah. And I guess that's going to mean that that's only going to increase in the coming years. And how we at the San Francisco Community Health Center and at TransThrive are able to meet that growing need, which sort of gets us back to a show of hope and raising money for this important organization. And I guess my final question to you is, you've got supporters of Show of Hope in front of you. What do you say to them? Why invest in this? Can I go first, Carsen?
Okay. So why invest in Show of Hope in San Francisco Community Health Center? Honestly, it's because, like, I, as someone who is a medically complex person, I do bounce around quite a few clinics. And, like, the thing that really made San Francisco Community Health stick out was the fact that the folks who are working there were from the community. And, and you could see them actively trying to give folks the opportunities to become more involved with running the center and creating groups and, like, outreaching to their own communities to get those around them also engaged in care. And that is just something I find super unique and something that should be encouraged. And, like, the more funding we get coming in through these fundraisers means the more we get to be more creative, because that's the great thing. Yeah.
Absolutely. And in addition, trans people deserve the resources. The funds that we receive from Show of Hope goes towards our organization and the work that we do. Not only TransThrive, but the other departments that San Francisco Community Health powers. And so it's definitely important to show face, not just as a supporter, but someone that is a accomplice to our advancement in life. And then we have some entertainment. We're recognizing some very important people: Nancy Pelosi, Cecilia Chung, and Mayor London Breed. But then we'll also have some entertainment by Martha Wash. So it's going to be a fun evening.
Oh, hell yeah. And for many people of my generation, well before yours, but from London and from Europe from the 1990s, Martha Wash, although we may not necessarily know her name, was a huge star as the singer for Black Box, Ride on Time, and Everybody. So yeah, I got to say, I can't wait. And so how do people, viewers and listeners, find out about Show of Hope? Where do they go to find more information?
sfcommunityhealth.org.
Wonderful. sfcommunityhealth.org. And we'll include that in the show notes as well. So with that, I just want to say thank you so much, both for sharing your time today with us, but also for the incredible work that you do, and for giving us the opportunity to visit with you today and and see the fantastic center that we have here. So thank you so much.
Thank you.
Well, that's it for this episode. Thank you to Carsen and Monique and everyone at TransThrive and the San Francisco Community Health Center. Thank you to Eric Aspera, our director and producer, and to our cameraman, Dmitry Nikolaev. Finally, a big thanks to you. You can find out more information about A Show of Hope and indeed the San Francisco Community Health Center itself at its website. And again, information about that will be in the show notes to this episode. Have a great week and a safe week, everyone.